Ethics in counseling.
In this video, we're going to be talking about some ethical principles that need to be in place.
With regard to our loving concern for our clients, accept all patients regardless of race, creed, gender, or other dividers. Respect people's freedom of choice. Swear that we will not manipulate or abuse clients in any way. We refrain from sexual intimacy with clients. We abstain from invading their privacy as clients, but we go with only what they tell. In regard to confidentiality, do the utmost to protect the confidentiality of a client. Refrain from mentioning the names of clients that you may be counseling to other people, not even to your own wife or family. Keep records private if you keep records at all. There's some issues whether pastoral counselors who are working in a non-professional manner should keep records, but if you do, keep them private. Inform about and uphold limits of confidentiality as defined by law. There are some exceptions to it, and you need to know those exceptions. Do not use stories about clients from the pulpit. Competency. Be well trained for the services you provide. Refrain from implying competency in things where you have no competency, but stay within the level of your training. Avoid using legal exemptions for competency. In other words, be honest about how competent you really are. And continue to study. Know your human limitations. Be aware of any human limitations or biases that you may have. Avoid from fostering the conception that I am omnipotent or omniscient. Admit when you make mistakes. Refer clients when you're not capable of dealing with them as well. And avoid participating with others in things which I do not understand. Don't try techniques that you really don't know, but stay within your limitations. If you do research that involves people or counseling, keep this in mind. Conduct your research openly and not secretly on patients. In other words, if you are going to use counseling for research, inform your counselees that you're ethical response to colleagues. You may hear about people who are doing unfair or unsafe practices in their counseling. If suspecting a Christian colleague of violating rules, confront them according to Matthew 18. That is to go to them directly first, and then if that doesn't work, take a third party, and then take them to the higher body or court. Follow civil rules as well as scriptural rules. Stay within the letter of the law in all of your counseling. In regard to personal relationships with your counselees, keep these things in mind. First of all, avoid dual relationships. Dual relationships are where you are in business with a counselee or where you are a friend with a counselee. If you're dealing with friends or business associates or people you're dating, always refer them to somebody else. Avoid counseling in compromising situations. In places, for example, counseling people of the opposite sex behind closed doors, or in restaurants where your presence may be misconstrued, or by the swimming pool or on sporting event. Make sure that you are covering yourself from even the appearance of impropriety. Avoid cross-gender counseling unless under strict oversight. In other words, if you're counseling anyone from the opposite sex, make sure that you do it behind open doors in a clear place where you cannot be misconstrued as being alone with them. Do not take gifts from counselees. It's very tempting that they want to show their gratitude by giving you something. Do not allow yourself to do that. It changes the relationship when you take gifts. Avoid using your counseling influence to persuade the counselee in other fields. Don't try to persuade them on politics, or don't try to persuade them to buy this product or to do this or that, of which you're not an expert. But stay within your competencies in your counseling fields, and don't use your influence to persuade them on.
Some things to consider when thinking about cultural competence are the obvious: race, gender, age. But some things are not so obvious. We might not recognize the impact of socioeconomic status on our client, or may not be aware of sexual orientation. Disability status may be obvious depending on the disability, and religion often is not obvious at all. We make assumptions about our clients all the time. One of the things we do as a culturally competent counselor is try not to assume things. We use language which is open rather than making assumptions about people. For example, we might ask if the person has a significant other rather than asking about a spouse or a husband or a wife. We should ask if a person has religious or spiritual beliefs rather than assuming that they go to a particular church. These are all things which help us to be more culturally sensitive to our clients. One of the biggest things we attempt to develop while you are in the program is self-awareness. Engaging in self-reflection may be uncomfortable, but it is extremely important for your journey. In addition to developing cultural self-awareness, counselors must also seek out knowledge that will enhance their understanding of clients who are culturally different from them. The third goal of ethical multicultural practice, as outlined in your text, is to develop culturally appropriate skills and intervention strategies for counseling diverse clients. The Association for Multicultural Counseling and Development, a division of the American Counseling Association, has developed competencies for multicultural counseling. Be sure to look in the course documents where I have uploaded a copy of that document. I would definitely read over it.